program and the resource person. Dr. Charles, the full name goes Dr. Charles Prem Kumar Joseph. Are you there, Dr. Charles? Can you just switch on your video so that, yeah, good. Sorry, I didn't notice. Yeah, I'm so happy to introduce, normally people know Dr. Charles for his apologetic sessions, for his sessions on evangelism and key issue-based topics where he constantly comes and teaches us, especially for us people who are in Chennai. He is one regular resource person, maybe for evangelistic camp, DT, discipleship camp, leadership, or any camp. And cheerfully he comes and he ensures to spend time with us. Now, to tell a little more about Dr. Charles. Now, Dr. Charles and his wife Priscilla, they, along with children and parents, they stay in Vellore. And Dr. Charles Prem Kumar is an alumnus of the CMC Vellore, a cardiopulmonary physical therapist by training. Now, in addition to this, he is an itinerant speaker. So what I remember is that he started joining from RSDM and later he moved into a global speaking and writing. He constantly speaks, writes, and he has his own YouTube channel where he encourages and engages people on topics which are very current and very necessary one. And with confidence and clarity, he presents the topic and rooting onto the scripture. Both of them are based at, and right now, Dr. Charles is having a manual therapy practice in Vellore called the CSK Charlie Spine Clinic. We have gone to his place and we have experienced their hospitality and care. So I believe that if some of you are really interested in taking some treatment, it is the best place to go and to be with them. In fact, as Brother Dr. Charles' wife Priscilla have been a very close friend to my daughter, especially the younger one, who Priscilla, she's a trained Montessori consultant. She does a lot of coaching and she trains people. At the same time, she mentors and helps young children to find out the right direction, especially daughters like mine who have got engaged with her and spoken to her, have guided her and literally led her to the right direction to career selection and so on thing. So that's about Dr. Charles. Dr. Charles and I started, we know each other from our training department time, where we were closely connected, where he's a regular faculty for the Bible Study Center and other apologetics programs that we have conducted. So we are glad that this morning Dr. Charles is with us. Dr. Charles will be speaking and addressing to us. Dr. Charles, welcome to be with us. Some of us are your students whom you have taught evangelism and apologetics in study center, and some of us are new to you also. So we are glad that you are among us, and we pray that this will be a blessed time. Once again, thank you and welcome. Yes, Dr. Charles.
Thank you. Thank you so very much, Brother Jacob, for that warm words of introduction and keeping it very, very personal. And also excited to hear a little bit of what Brother Jose was winding up and saying. And it was beautiful and brings me back memories of the Kotagiri days where I used to be a regular when I was part of RZIM. We used to go there at least once a year and then train students in the study center. So lovely to meet you. And also, Brother Sudhir, thank you so much for this lovely invite and this honor and privilege to speak to all the staff in this platform. And I'm really, really grateful that this was organized. And I'm kind of very excited and in some ways overwhelmed by the amount of emphasis on and input on staff care and staff health. I don't think very many organizations really do that. And I'm pleasantly surprised and pleased to learn that there is an entire department that is working in this space. And I should mention the one that perhaps was instrumental in making all of this happen, which is my patient and your staff, Ved Prakash. I know Ved Prakash from the time he was in the study center. We've been in touch for many, many years now. And of late, he told me that he had a back issue, and that's how we got it. We got talking specifically, and I've been trying to help him online. At one particular point in time, I realized that he had to come physically because the pain wasn't really going away, and so he did come. Thanks to all the staff that encouraged him with leave and facilities to make the travel, and he was here at the clinic. We treated him for about a week, I think, and I hope, I just hope that he's much, much better. So that is how I think this conversation started. And then he said there are many other staff also that have neck pain and back pain, and can we do something? And so the rest is history. I think Brother Sudeep took it on from there, and I'm very grateful this morning to be among your midst. So without further ado, I'm going to pull out my PowerPoint. And I have put together, based on the objectives that were shared by Brother Sudhir, a kind of a presentation. It's always a challenging thing to pitch the presentation right when the audience is so varied. So it might be very basic for some of you. It might be a little too technical for some others, but please do understand that it is not easy to pitch it right for all 150 plus of you. And so I think after my presentation, we're going to have a time of interaction. And Brother Sudhir, please do give me a little bit of a warning in the last 5 minutes, and then I'll wind my talk up when my time is over. And then we will go on into personal interaction and Q&A and clarify things. Okay, so I'm sharing my screen, and I hope it is visible for most of you. T3 is how it has been named in the flyer, and I think that is the creative genius of Brother Sudhir. But for the purposes of this talk, looking at the content and the context, I thought I should call it as missionaries on the move. All of you are missionaries, including me, and in some ways, every disciple of Jesus Christ is a missionary. And if missionaries are creating movements, we are people that are constantly on the move. And when we are constantly on the move, traveling, up and down and crisscrossing our regions and crisscrossing the state and crisscrossing the country, and perhaps even, neighboring countries, I do not know. Obviously, our bodies are going to take a beating. So that is what we're going to look at today. We're going to look at something that I would like to call as an occupational hazard. For a missionary, one of the occupational hazard is spine health, or the lack of spine health. Now, while we're all busy trying to fulfill the great commission which our Lord has given, one of the costs that we are paying is that we are making a great omission, and that omission is about our own self-care and about our own health. Yes, Christians are called to be selfless, but it does not mean that we ought to be negligent of our bodies. Like Brother Jose beautifully said, our bodies are the temple of the Holy Spirit. And so if we did not sufficiently take good care of our bodies, then we are actually, in trying to fulfill the Great Commission, we are also committing a great omission about the responsibility that God has given us about our own bodies. Now, let me start with this. Why do we feel pain? Why do we feel pain? I need to tell you a little bit of my own story as a missionary. I used to work in CMC I joined in 1994 as a student. I finished in around 2000. And since 2000, I have been working in CMC and teaching in CMC. And in 2010, I decided to go into full-time teaching and preaching ministry. And when I went into teaching and preaching ministry, that is when I realized the amount of travel that an itinerant teacher, preacher, missionary had to take. I did that for about 5 years. In 2015, I was diagnosed with disc prolapse at 4 levels in my lumbar spine and 3 levels in my cervical spine. And I was not even 40 at that time. So out of the 33 vertebral levels that everybody has, 7 of those vertebrae had bulged out, and the doctor said within about 2 days or by this weekend, you have to get admitted and you have to undergo a surgery. But thankfully, because I am also a spine person and a spine physio, I said at 35 and 40, I do not want to go for a surgery. And let me see how this can be sorted. And so I decided to treat myself. And of course, the whole church prayed for me. And God, in His mercy, healed me little by little by little. Long story short, I was on bed for literally 3 months, not able to travel. But thankfully, my disc that was bulging and waiting to break out actually shrunk back inside and my pain reduced. Fast forward 5 years later, my mother was undergoing cancer treatment in CMC, and we used to live on the first floor. And so one particular day, she was too frail to walk down the stairs for chemotherapy, and I had to carry her. And so, like a good, responsible son, I did that. And again, the same thing repeated itself. I ended up with another acute episode of disc prolapse. This time again, the doctor said, multiple levels, you have to go for surgery. I was not having a heart to go for surgery. I said, since I'm a physio, let me again rest and let me again try what I know and let God heal me if He needs to heal me. So that's my story. And this morning or afternoon, when I'm speaking to you, I'm not speaking as a theoretician. I'm not speaking as somebody who is a health professional. I'm speaking to you as somebody who is empathetic of some of you that might be going through back pain and neck pain and joint pains and all sorts of pains and be wondering in your head about what should I do? So the big question that we need to understand before we dive in is, why do we feel pain at all? And the answer is actually in Genesis 3. It is a theological answer. Now, we are the ones that invited pain into this world and sickness into this world and sin into this world. And we are waiting in the intermediate phase before we will go to the new heavens and the new earth, where there will be no more pain and no more tear. So pain is an effect of the fall, and in simple words, that is why we all feel pain. Perhaps if our first parents had not sinned, maybe there would not have been pain at all. And there will come a time when we will not have any pain. And so whoever is in severe pain, chronic pain, unrelenting pain, pain that cannot be eased out by any treatment, please do rest assured that we are heading towards that Beulah land where there will not be any more pain one day. Okay. Now, what is this pain and why did God allow this pain? Pain is like an internal alarm system that alerts us to the danger in our body. Our body, our muscles and our ligaments and joints are not able to speak words. And so the language in which they communicate to us, the owner of the body, as it were, is by crying out in pain. So pain is body's language of communicating that there is something wrong with us on the inside at a tissue level. And many people, when they have pain and then they have an important assignment to do, they somehow symptomatically suppress that pain and self-medicate and push themselves and go and do things. What we are doing is we are not listening to our body. We are not being wise enough and picking cues from our body. And so we are continuing to tax our body, and we are requesting it to continue to slave for us and to keep crying out and disintegrate in pain. So please understand that after the fall, pain is an internal alarm to wake us up to the dangers that could be sitting inside our body, and we need to pay heed to that. Now, there is a verse in the Bible which says that the Lord doesn't look at the outward appearances, he looks at the heart. Okay, when I read this verse, I tend to think maybe the Lord is a cardiologist. But when I look at people, I'm not looking just at the external, personality or the picture of people. I am looking actually at their spine. I am, in fact, thinking how their MRI is going to look. Now, that is how my MRI on the inside would have looked a few years ago if I had taken one, and I did take one 10 years ago, and it looked worse than this. So whenever we look people on the outside that are dressed nicely, that are cheerful, that are smiling, we actually have really no clue what is perhaps going on inside their bodies. And when they come and tell us, even to spouses or to children, many of us just look on the outside and they think, oh, maybe you're just giving an excuse, or maybe you're just too lazy, or, you are somebody that doesn't want to work hard. So just, get on with your work. No, there could be many things that are going wrong on the inside for a person physically and oftentimes emotionally that we don't pick up on the outside. But from today, I want to create an awareness about not just looking at people, but also trying to interact and understand people and how they could be hurting in some ways that is not evident to us on the outside. Now, here's the typical cycle of somebody that is going through pain. Let's say somebody is going through severe neck pain or back pain. And typically what that person will do when that pain reduces a little bit and when they are having a good day in a string of bad and painful days is, on the day that they feel nice and good, they will go and do gardening. They will go and, repair the fan. They will go and do this and that and the other, because in a long time, for the first time, they're feeling really nice and good. So they are overdoing things that they've been waiting to do. And when they overdo it, then again, the pain that reduced increases. And because the pain has increased, then they say, oh, now I know I should not do anything, and they will rest and they will recover. And again, when they have recovered a little bit and it's another good day, they will go ahead and overdo it. In medical parlance, we call this as the boom-doom cycle. Okay, there is a boom of activity when we feel nice. And then because we overdid certain things, we cause doom on ourselves. And this is often true of ladies. This is very true of my wife, and she's not hearing me now, and so I can say that. On days that she feels really good and fine, overdo things, and then again, take a beating in the body and won't be able to do. And again, when you feel nice, you overdo. Okay, this is like being like Martha and being like Mary. Okay, either this or that, and there needs to be a balance for people that are going through what is called as pain in their body, and they should avoid this cycle. So many times we are people that speak on stewardship and we know what stewardship is and all of that. But oftentimes I have given talks on stewardship in UESI camps. But oftentimes we are speaking about creation care, we're speaking about, financial stewardship and so on and so forth. But we feel too shy to speak about the stewardship of the body. We somehow have a picture like the Greeks, thinking that the body is evil and wicked, which it is in a fallen state, but which can be redeemed now that we have met Christ and that we are called to be good stewards of the temple of the Holy Spirit that we are. All right? So oftentimes, as missionaries on the move, we keep taking assignments and programs and meetings and whatnot, and we travel far and wide visiting people, many times beyond our capacity and capability. The story is told of a man who owned a camel. And so he was somebody who would use his camel to transport things from one place to another. And the camel is a burden of, is a beast of burden, is a beast of burden. So it can take a lot of weight. Okay. And that's a real picture of a camel. That's how much a camel can pull. And so this man stacked up his camel, and as he was going down his village, there was another man that said, hey, you know what? I was supposed to go to the village too. I was supposed to take some of my grains too, but somehow my cart is broken and my camel is ill. Would you mind taking another 10 more bags of grain? And so that man happily said, oh, come, bring it on. My camel can manage. So he dumped 10 and the camel was just fine. As he continued to go even further, another young man came and said, you know what, I also need your help. Can you transport these 5 bags to my granny that's living on the way? And then if you can do it, I'll pay you. And so again, another 5 bags were dumped on the camel. And so it happened repetitively for 2 more times where 2 more people dumped things on the camel. Finally, after the last person dumped something on the camel's back, that person was carrying a baby, and the baby said, I also want to add something to this load. And you know what? It is only a little straw. And so when the baby put that one little weightless straw, the camel collapsed and crushed down. That's oftentimes the story of each one of us that have been pushing ourselves with many things, important as they are. We think our bodies are taking, and finally, when you do something very, very trivial like bending over or just coughing or lifting a little suitcase, our backs and our necks immediately snap. So I want us to understand all of this before I want to show you a particular video on what our spines actually look like. What our spines actually look like. Now, this is how our spines look like, especially the lumbar spine.
The spinal column, or backbone, is one of the most important parts of your body. It provides the main support.
Are you able to hear the audio?
Yes, we can hear.
The YouTube audio?
Yes.
Thank you.
Support, allowing you to stand upright, bend, and twist. 33 individual bones interlock with each other to form the spinal column. The vertebrae are numbered and divided into regions. C1 through C7 cervical vertebrae form your neck, support your head and neck, and allow you to nod and shake your head. T1 through T12 thoracic, that's the 12 vertebrae that are joined by ribs to form your rib cage. L1 through L5 lumbar, your 5 sturdy lumbar vertebrae carry most of the weight of your upper body and provide a stable center of gravity when you move. 5 vertebrae of the sacrum and 4 of the coccyx are fused. It makes up the back wall of your pelvis. Between each of the movable vertebrae is located the intervertebral disc. Intervertebral discs consist of a thick outer layer with a crisscrossing fibrous structure, annulus, that surrounds the soft, gel-like center, the nucleus. Discs function like shock-absorbing springs. The annulus pulls the vertebral bodies together against the elastic resistance of the gel-filled nucleus. When you bend, the nucleus acts like a ball bearing, allowing the vertebral bodies to roll over the incompressible gel. Each disc works in concert with 2 facet joints, forming a spinal motion segment. The biomechanical function of each pair of facet joints is to guide and limit the movement of the spinal motion segment. The surfaces of the joint are coated with cartilage that helps each joint move smoothly. Directly behind the discs, the ring-like vertebral bodies create a vertical tunnel called the spinal canal or neural canal. The spinal cord and spinal nerves pass through the spinal canal, which protects them from injury. The spinal cord is the major column of nerve tissue that is connected to the brain and serves as an information superhighway between the brain and the body. The nerves in your spinal cord branch off to form pairs of nerve roots that travel through the small openings between your vertebrae, intervertebral foramens.
Right. So that is actually how our bodies look on the inside, and each of us are standing on a skeletal framework. Now, this is the skeletal framework, and this is how each of us are standing on a skeletal framework. And these are 33 bones, one on top of each other, each uniquely shaped depending on the region that is in question, and each having what is called as an intervertebral disc, which is a very, very soft and squishy layer, which is called as the shock absorber of the body. And now, this yellow little thing that is behind the vertebra is the spinal cord, and on the sides we see the nerve roots that are coming out that go and supply our hands and the sides of our body and our legs. So what happens is, whenever we are sitting or when we are standing, the entire weight of our body goes on to the spine or the vertebral column. So let's say, for example, I am 72 kilos and my upper body will roughly weigh about 50 kilos. Now, if any of you have ever seen a 50-kilo rice bag, you know that you were not able to lift it on your own. Now, that 50-kilo rice bag is my upper body sitting on my vertebral column and transferring weight, 50 kilos from here to here, from here to the next level and next level and next level. So when we are traveling, or when we are walking, or when we are carrying a load, when we are climbing upstairs, climbing downstairs, what are we doing? We are carrying that load against gravity. And when we are sitting suddenly and plonking ourselves onto a chair, onto the car seat, onto the bike seat, onto the bus seat, onto the train seat, we are actually dropping a 50-kilo weight onto our spine. And when we repetitively do it many times throughout, without giving our bodies enough time to recover and rest, our body is capable of taking a lot of load like the camel's back. But beyond a point, and we don't know when, that little activity could be the last straw on the camel's back, and our disc opens up, and then we say that I have a disc bulge, and the symptom is a back pain, or I have pain down my legs, or I have pain down my arm. And then we wake up to the reality of how our body has been not adequately cared for. So that's really what is happening to us when we are unaware of the possibilities of injuring our bodies. Okay. Now, I told you a little bit about how we are built, how our spines are made, how God has fearfully and wonderfully made all of this in amazing ways that human engineering can never, ever, ever, ever replicate. For anybody that has studied even high school biology or biology at a graduate level, and you've looked into a microscope, you will know the beauty of the intricacies of how God has fearfully and wonderfully made us. And that's how our spines function too. Now, there are some very common spine issues that I want all of you to be aware of, whether it is in the neck region or in the chest region or in the low back region. All of these three regions are called as spinal column. And there are only roughly 4 major categories of spine issues. The first one, which is the major chunk, is people will start having low back pain. They will say, my back hurts when I stand and work for long. My back hurts when I sit and work for too long. My back hurts after travel. My back hurts when I bend over and sweep or mop or wash clothes or, clean vessels or wash my car or bike. My back hurts. Now, at a very basic level, this is called as a lumbar strain. What have you done? You have overused your low back so much and not given it adequate rest to recover, and repetitively injured your ligaments and disc, that your low back is crying out and saying, Master, just give me some rest. I'm not feeling too good. Okay, so that is low back pain, commonly called as lumbar strain. It usually will be there for 4 or 5 days, and then with some rest, it will go away, but it will not abandon you. It will come back again to visit you after 6 months. Okay, and then again, you give it some pampering, it'll go away, and then this time it'll come a little early, it'll come back after 4 months. Then again, you pamper it, take 2 days of leave, cancel a trip, but next time it'll come back in 1 month. And finally, it'll come and be a permanent guest in your body. And every waking morning, you will wake up with pain. So that's the story of a typical lumbar strain. The second common thing that we all have because of modernization, especially because of the computers and digital work that we do, and now because of our phones, is cervical spondylosis or neck stiffness. I have many young people that come to the clinic and I keep asking and questioning them, and finally they confess that they have a tendency to lie down in bed and keep looking at their mobile phones for, hours together, scrolling Instagram and looking at shots and stories and whatnot. And so their necks are being used too much in a wrong position, and the muscles are overstretched, the ligaments are overstretched, the disc is getting compressed, and the patient comes and says, my neck is stiff, it is locked in this position, I'm not able to lift it up, I have neck pain, and sometimes it travels down my hand. So that is cervical spondylosis. Then the third one that commonly that we know of is called sciatica, which means a radiating, sharp shooting electric current-like pain down the back, in the backside of our thigh and the backside of our knee and backside of our leg, all the way to the foot. Now that is called sciatica. And if any of you have sciatica, that means you really need help and treatment. It only means that your disc is not just disturbed, it is very, very unhappy, and you've loaded it too much, and it is just waiting to break open and leak all of the gel-like material that is used for shock absorption. It is pressing on the nerve. And finally, if we don't take care of it at that stage, the disc itself will slip forward and it will lead to sometimes even muscle weakness and inability to move our feet, stand and walk also in extreme cases. So these are common spine issues that we need to be aware of. Now, why do all of these things happen? These things are happening because the way we used to work has changed so much now. Now, when we are working mostly, let's say, for somebody who's in the admin or somebody who's preparing sermon notes, somebody who's preparing PowerPoint, and even now, all of us that are sitting and listening to this talk, and even me sitting and giving this talk, long sitting hours without break. So I'm going to ask you all to do something now, okay, as the good physiotherapist. Okay, if your cameras are on, I want you all to stand up and relieve pressure right now. It's okay. Go ahead and stand up and relieve pressure wherever you are, even if you are not with a group, even if you are just there at your home, nobody's watching. Yeah, stand up, relieve pressure, lift your hand up, turn around, look at somebody, smile, turn to the side, rotate your neck, head, movement. Movement is medicine. Movement is medicine. So sitting for long hours without break, okay, now you can all sit back. That's all that your body requires by way of decompression. That's all the pampering that your body is asking you. It's not asking too much of us. It's just saying, I'm willing to slave for you, but just give me some attention for maybe 2 minutes and I'll slog and serve you for another 2 hours. Okay, so long sitting hours without break is a risk factor. Poor seat design. Back in the day, I remember my grandmother telling me when I used to go for vacations to, my mother's place, don't lean and sit against the wall. Okay. So she used to say, don't lean and sit against the wall, sit upright, sit upright, sit upright. So we had to wait for her to go out of the room to be resting our backs against the wall. But all of that is old story now. We are in a new generation with new demands on our body, with different lifestyles. So if you are somebody that's spending the majority of your day sitting, then you make sure you are sitting on a good surface with a good seat design, ergonomic chair, ergonomic workspaces. I'll tell a little more about this later on. The next risk factor is lifting heavy luggage incorrectly. And I think this was my problem when I used to work in RZIM. I used to be traveling at least 2 weeks in a month. And most of this was travel to sometimes neighboring countries, traveling the length and breadth of our country, metro cities oftentimes, predominantly air travel. Only going to the through the airport was by road and perhaps to the hotel. I thought everything is very comfortable for us. But I did that for 10 years. And believe me, every time you are packing up your suitcase, every time you're picking it and putting it in the car, every time you're lifting it and putting it in the cabin storage space, every time you're picking it back from the luggage belt and back into the car, and again into the hotel, sleeping in different kinds of beds. You do it, you do it, you do it, thinking, everything seems fine, everything seems fine. But on the inside, everything is not fine. And so repetitive lifting heavy luggage incorrectly will again cause back pain and neck pain and bulge our discs. The next important thing is hydration. Hydration. When all of these Westerners used to come to India, one observation that I have made when I was young is that they will all carry their own water bottles. I used to wonder, oh, this is probably looking stylish or cool. I don't know why these guys are doing all the time carrying their own bottles. Sure enough, they were afraid to drink our water, thinking they'll get infected. They don't have much immunity. But I later understood that as part of their psyche, they need to stay hydrated continuously. But we Indians do not hydrate ourselves very regularly, which means we don't drink enough water regularly. Okay, so whenever we eat and after eating, if the food is spicy, we might drink a little bit of water. Before eating, our parents tell us not to drink water. And only when we are thirsty, like really thirsty, we drink water. Now, that's not the way to drink water. We need to constantly keep hydrating our body, because when water goes inside the body, all the tissues are very healthy and elastic and hydrated. So the stiffness in our joints, somebody said, I had a creaky sound, I had a clicky noise and all of that. Please hydrate yourself. Please drink water. If you've already been drinking, let's say 1 liter, that is too less, double it. Some of you that are big built and sweat and dehydrate a lot, I would say you can even drink 2.5 to 3 liters per day. And that's an important thing. Then the other risk factor is poor fitness. Now, most of us Indians are rice eaters. I'm South Indian. I'm a big rice eater. I'm a big fan of eating rice. Okay. My wife grew up and lived in the north for a long time. So she is a chapati roti person. I am a rice person. Even if I went to the US, the first thing that I will do is I will look for an Indian restaurant and I'll have to go and have a non-veg thali or some form of rice. Otherwise, I just couldn't sleep. That was my psyche. But you know what happens when we are eating rice? Roti and rice are all carbohydrates, but when we are eating rice, we have no way of finding out how much we are eating until our stomachs bloat and they tell us enough is enough, there is no more space, now you stop. And if the side dish is really nice and exciting, there is really no measure of how much you eat every day of carbs. But for a roti eater, it'll be a number in the head. And so we tend to develop a lot of body fat in our midsection, around our belly and the side of our hips and our bottoms. That is how generally the Indian body structure is. Like a pear, they describe the Indian body structure like a pear. But that is because we do not have a method and a science to how much we are eating and when to stop, especially if you're South Indian, because there is no way of measuring and saying, okay, I'm done for now. The other risk factor is stress. You may not believe me when I say stress will cause or increase your back pain and mess up with the improvement of your back pain. Now, all of us, the Bible says, are fearfully and wonderfully made. And when Jesus says in Mark 12:30, he says, love the Lord your God with all your heart, soul, mind, and strength. So we are a very complex makeup of heart, soul, mind, and strength. And so when we have an issue in our body, it affects our mind. Now, when we have a stress in our mind, it affects our body. And so stress and lack of sleep are all risk factors to back pain. All right. And where did the PowerPoint go? Ergonomics. I want you to look at this video now, and I will show you a little about how we need to sit and how we need to, for those that work excessively on your computers, that are writing and preparing and teaching and preaching. Just give this a listen. That person has neck pain. So what are they supposed to do? They're supposed to make some changes. The head posture has to go back. There has to be back support. The chair has to come close. The laptop has to go higher. This person has neck pain too. So he has to become upright. The elbows are supposed to be at right angles or 90 degrees. So he needs to change his chair. He needs to come closer to the table. He needs to lift his laptop higher so that it's at eye level. Okay, the legs are hanging, so need a foot support. Set an alarm for half an hour. After half an hour, take a break. You don't have to cycle, but you can just get up and walk around in the room. So very simple things, very simple things, very practical things that we all can do will go a long way in reducing load on our spine. Now, in the next 5 minutes, I'm going to bring this to a close by teaching you some practical stuff. One of the important things that should get into your head from this talk is that if I'm achy all over, my body is trying to communicate that it needs a little bit of care and rest. And what kind of a care will my body like? My body will like touch and squeeze, okay? So let's say, for example, if your neck is hurting, you can put your hand there and maybe just press it and relax. Press and relax, press and relax. And oftentimes, the body immediately loosens up and relaxes. The second thing is try to create 2-minute stretch breaks every 40 minutes to 60 minutes of uninterrupted work in one position. 2-minute stretch breaks every 40 to 60 minutes. Okay, which means just get up and just turn around, just move your head, just move your arms, just bend over, do anything at all to stretch all of those achy muscles. And all of us instinctively, God has tuned and wired us to be able to stretch. That's why when we wake up in the morning, we automatically go and stretch. Even if you look at animals, if you have cats or dogs as pets, from time to time, especially after waking up from sleep, they will arch their back, they will stretch their limbs, and that is something that is intuitive to us as part of creation. So stretch, stretch, stretch. So that's stretch. The second one is mobility. Move, move, move. What are you supposed to do? You're supposed to roll your shoulder 10 times. Can you all try and do that for me? Roll your shoulder 10 times right now. Can you do that? And in rolling the shoulders, you only have to roll it backwards. Don't roll it forwards, because most often all of us have a forward-headed posture. So we don't want to worsen it. We want to roll it back. We want to roll it back. We want to make a little C. Now, if you have done that, you will feel a lot better already. So just do about 10 repetitions of that. Then do your neck side bends. Come on, I want all of you to do your neck side bends. Maybe 5 times. For some of you, it might be creaky. And don't get scared. Don't overdo it. Don't overstretch it. Do it very nice and gentle and slow. Okay, now I could ask you to arch your back. Okay, so you all need to again stand up. I'm also going to stand up. Let's arch our back. Okay, stand up. I hope you're able to see me. Arch your back like that. Arch your back, arch your back, arch your back. Yes, bend backwards, bend backwards, bend backwards, and a little forward now. Okay, and again, backward, forward. All right, and I'm not going to tell you to do the last thing because all of you will walk out on me. Short walks otherwise when we finish this program. All right, so all of these are things that can really make a world of a difference even before your backs are beginning to chronically hurt. And there are few mobility drills and posture and strength workouts. And here are some examples. Now, this one is a very, very safe one, is a common one that generally we give to all our patients. I may not be able to demonstrate it, but here is the picture. You can try it out later on. Go on all fours with your palms and your knees and arch your back down like that and curve your back up like that. Arch down, curve up, arch down, curve up, arch down, curve up. Now, if you are curving up, that is called as the cat position. If you're curving down, that is called as the camel position. All right. So that's something that you can do. Another thing that we can do is we can lie down like this on our back with our hips and knees bent and our feet on the bed. And we can roll our knees from one side to another. Drop your knees from one side to another. Nice and gentle, nice and slow. If you do that 5 times in a very rhythmic fashion, and when you get up, especially before getting out of bed in the morning, you will see that your back is a lot relaxed and it is not creaky and stiff anymore. Okay. Now, this is something that younger people perhaps can try. If you feel a lot of tightness, if you're not able to bend over and touch your toes, you can go to one corner of the wall, lie down on your back and just stretch out one leg onto the wall as much as you can. Stay like that for about half a minute. If you can, stay like that for 1 minute, even better. Your back hamstring muscles will get stretched out. And so after this, when you stand, you will feel that your back is not hurting anymore. These are all general drills for people that need flexibility, that need some pampering of the back. But if you have a serious problem like a sciatica and all of that, please don't do any of these things that I'm saying. You need to be examined. Now, when do I consult a medical person? Is every back pain something that we need to be afraid of? No, every little back pain is not something we need to be afraid of. Pain that is lasting for more than 2 weeks, severe pain, continuously. Okay, severe pain that is lasting for more than 2 weeks. And on a scale of 10, if a knife stab is equal to 10, any pain that is greater than 4 out of 10, okay, is another reason to consult the physio. And if pain is disturbing your sleep at night and you're waking up with pain, then you need to consult. If there is any numbness or tingling in your arms or in your legs, or if there is a sharp shooting pain like an electric shock, or weakness of toes or fingers, then you need to consult a physio. Or if you're locked in one position, you're not able to, straighten out, or you're not able to bend and you can't even really breathe, obviously you have to go and get yourself checked. Okay. So all of these things, you can go and check a physio directly, or you can go and look at an orthopedic surgeon or a physician, and maybe if necessary, they'll ask you to do an MRI or an X-ray. Okay. So what are we supposed to do? We as Christians are supposed to love the Lord with our strength also, which means our physicality, our bodies, right? Mark 12:30. So we need to, first of all, learn how to listen to our body and rest when needed. Now, I find it very, very difficult to treat Christian preachers and teachers. You know why? Because they have a long list of assignments and they have this program and this travel and that travel lined up. They come to me, Charles, you know what? I have this big issue. I have severe back pain. I'm not able to sleep. Can you do something? I'll say, yes, I can do something. Can you come and get yourself treated for 5 days? They'll say, no, but day after tomorrow, I'm going to Bangalore. The next day, I'm going to Chennai. The next day, I'm going here and there. I'll say, no, you can't go. You need to rest. Oh, but they'll say, no, this is ministry. Charles, how can you say don't go? Do I rest and not go to ministry? Then I always pull up the example of the great prophet, okay, and how the Lord told him to rest for 40 days and rest and rest and rest, so that the assignment that is ahead of him is greater and he needs to recuperate. So some of them get it. The others of them think that I'm pulling things out of context and they still go for their assignments. And I wait for them to really break their back and come to me again. I'm just saying it tongue in cheek, but their condition worsens and then they learn it the hard way. Okay, so we need to learn to listen to our body and rest as needed. We need to just make small posture differences, and that'll make a huge difference. We need to understand prevention and fitness is better than cure. We need to become aware and care for our spine from today. We need to stay fit. We need to stay pain-free, because we are the missionaries of God. We are the ones that are going to take the gospel in this land, or we can't be wounded soldiers. We need to be people that are fit and fine, and we need to have our back strong so that we can hold other people's back strong and we have their backs. All right. So I'm going to stop. I think it's time. I think I overshot by 5 minutes. I'll stop here. And I could have said a lot of other things, and in an online platform, and for the very first time, this is all that I thought was sufficient and important. Maybe if there are specific questions and issues that you have, you can ask me and I'll try and answer those. And if need be, we can think of maybe even another session, depending on the need and demand. Yes, brother, over to you.
Yeah, thank you, brother. Thank you very much for your presentation. It's time for the Q&A. If anybody want to ask any questions, please unmute yourself and ask questions. Or you can also in the chat box also. You
yes,
can write.
Missionary is not machinery.
Brother, what about the tailbone pain and the muscles? I have tailbone muscle pains because of too much sitting and traveling.
Correct. So the tailbone pain is called as coccydynia. So this is, I don't know why this thing is, maybe because of the virtual background. Just give me a minute. Okay. Can you all
Yeah,
see me now?
no.
Oh, sorry. Okay.
Yes.
Is this better? Yeah. So this particular little bone is called as a tailbone. And when we sit on that particular bone. Oftentimes, we usually have muscle layerings to cushion that bone. But sometimes when we don't have adequate muscle cushioning, when we sit directly, that bone goes and hits the surface of the chair in which we are sitting, and it gets injured. So that's called coccydynia. This happens in people that sit for a very, very long time, and people that travel, often, and that have injured their backs, or people that have fallen on their bottom, and several things like that. So for tailbone pain, there is a treatment called as ultrasound massage. So there is a machine called ultrasound machine. It's not a diagnostic machine, it's a therapeutic machine. It releases ultrasonic sound waves. It'll go and touch the inflamed tissue in that area. It'll vibrate it, and it'll push away all the pain substances and enhance healing. So that is something that you can try if you have not tried for at least 5 days with a good physio that is available locally. The second thing is there is a seating cushion called as a donut cushion. Now that cushion is available on Amazon. It's called as the tailbone pain cushion or donut seating cushion. So you can order and get that and start sitting on it. In that, the last portion where the tailbone comes in contact with the chair, that portion will be curved out, and there will be a pressure relief area. So when you're sitting, your tailbone is free of any pressure, and you can still continue to sit and do your work. Then the next thing that is important is you have to stand up and squeeze your butt. Yeah. So you have to stand up like that and tighten your buttock muscles. Okay. And when you keep doing that often, the muscles there will get toned up, and when you sit, there will be adequate cushioning. And there are many other things in manual therapy that we can do to find alignment issues and adjustment and all of that. Also, try to keep pulling your belly inside every half an hour, every 20 minutes. Just pull your belly inside, tuck your tummy inside, hold it for a count of 1, 2, and then relax. Yeah, so that will also help you. This is all that I can say in an online platform, but there's obviously much more that can be done, including corticosteroid injections. Yeah.
Thank you so much.
Yeah, we have. Yeah, please
Yeah.
ask, Suhasini sister.
Yeah, brother, just I want to know when the calcium tablets have to be taken, in which interval? Because I heard that only 60 tablets have to be taken. So,
Yes, ma'am.
yeah.
So for any woman that is postmenopausal, calcium tablets are a must because the body stops producing calcium, and whatever outside calcium we eat through nutrition, that is not adequate for a woman's body postmenopausal. So calcium needs to be taken default, but it was wise to do a blood test and look at the calcium values and then take it. Also do a vitamin D test. Vitamin D and calcium are mandatory tests that have to be done postmenopausal. For those of us that are working inside air-conditioned spaces and not really going out in the sun, vitamin D also will be less. And these two are very important for bone strength. So you can take a calcium tablet for maybe up to 3 months and then give a little break of, let's say, about 2 weeks or even a month, and then restart again 3 months. Some people say 3 months, 1 month break, 3 months, 1 month break. Some others say 2 months and about 2 weeks or 1 month break. Again, 2 months, take it and a break. That is because we don't want to overdo the amount of supplements we are taking, and that can later on go and form stones and deposit elsewhere. That's why oftentimes it doesn't happen, but just to be cautious. But 2 months and 1 month break is a good combination. I would even say 3 months and 1 month break in ladies is recommended. Thank you.
Thank you, brother. Thank you.
Sure.
Yeah. We have one question in the chat box. How do we identify the pains from bone or muscle or gastric?
Okay, so pain from bones will usually be night pains. Okay, so when you are sleeping in the night, okay, bone pain will be a very deep, boring pain. Boring means as if somebody is poked a needle into the bone and drilling it. So it's an unmissable pain. It's a deep, boring pain, oftentimes severe during the nights. Okay, that's one way. Muscle pain will happen whenever you are overusing the muscle. Say, for example, if you are cooking or washing vessels or something like, or even standing and preaching, your body will have a particular limit of, say, 60 minutes or 90 minutes or 120 minutes, depending on how you've trained it and how strong your muscles are. Now, if we are pushing the body beyond that barrier, then there will be a kind of pain that will start in one place and that will be a vague, dull pain that will spread in the surrounding. And as soon as that pain picks up, if you come and rest with your back on a backrest or just lie down, that pain will immediately, within about 5-10 minutes, go away. If that is the case, then that is a muscle pain. Okay. Now, gastric pain is totally different. It is visceral pain, and oftentimes gastric pain will be very sensitive to the kind of food that we are eating and our food habits, or if we are not timely eating because of the excess secretion of the gastric juice, you will have pain. Usually it will be around this area. This is called the epigastric area. All right, so usually it'll be around that area, and sometimes it'll also be associated with reflux. You know, when you're sleeping, there'll be something that is like a sour thing that is coming to your throat level. And so all of those are indicative of visceral, specifically gastric pain.
Yeah.
Yes.
Thank you, brother. One more question from our friend Lanu. Thank you for the session. How often does one need to go for regular checkup before the problem starts?
Oh, no, it depends on how old you are. If you are young, you don't really need to go for a regular checkup at all. I hope you're asking about spine health, right? Oh, yeah. But otherwise, whenever you are hitting 40, 45, it is important for men and women to at least have health checkups. If you have any pre-morbid condition, at least once a year. If you have no premorbidity or comorbidity or any genetic issues, linkages in the family, then maybe once in 2 years is also fine. But I would say once a year, if you are above 45 and you already have a known health condition, it is important. As far as back pain is concerned, if you're able to be active and fit, if you're maintaining your height-weight ratio. Okay, so let me give you an example, a quick calculation of how to find out whether we are overweight or right weight or underweight. Your height in centimeters. Now, all of you, do you know your height in centimeters? Let's do this exercise. Take a moment and think of your height in centimeters and minus it by 100. Height in centimeters, subtract that by 100 and you get a figure, right? You get a number. So what is that number? That number is your ideal weight in rough ways. I'm not telling BMI and all of those technical things. Height in centimeters minus 100 will give your ideal weight. Okay. Say, for example, for me, it is 72 because I am 172 centimeters and minus 100 is 72. So you find out what it is for you and you go and weigh yourself whenever you get an opportunity and find out how many kilos extra you are. And most of us, I know this from experience, at least about 60% of us or 70% of us on the call will at least be 5 to 10 kilos, if not more, extra than our recommended weight. I don't have the gift of prophecy, but I can say this with some certainty. All right.
Okay.
So,
Next question.
Yes.
How many hours
Yes.
continuously we can drive bike? How many breaks can I have within 2 hours driving?
Okay, depends on how old you are and whether you have any back pain issues already. If it is only a question of prevention, then I would say you can drive up to 1 hour and after 1 hour take a break. Okay, but that timing is not very set in stone. Whenever you feel your back is achy, you can stop and do a little stretch just for 2 minutes, have a little chai, whatever, and then get on and keep going. Young people think that if we take breaks, it is very unwise, it is very unmanly, it is ridiculous. It is not. Actually, that is very, very wise. You can continue doing biking even till you're 60 and 70 if you take breaks adequately when you need to. Next.
Yeah, one more question. Please suggest effective exercises to help reduce back pain.
Yes, so some of the exercises that I have showed you, like the cat camel position and the knee drops, there is something called as bridging, standing on your toes. All of these are general exercises. What I can do is I can send Brother Sudhir a little YouTube video on some safe exercises for back pain so that you can prevent it. But if you really have back pain and you need a proper exercise, you need to be given a customized program. There is no one size fits all. It's not like take 2 tablets of Dolo 3 times a day, your fever will go. That's not how it works with physio. You have to study the patient and you have to see what works for them. You have to customize it to them, and then that thing will be helpful for you. So, next.
Okay. Doctor suspected sciatic pain, but off late found out intramural fibroids, experiencing too much pain. Is it two separate issues or both connected?
Yeah, these are 2 separate issues. They are not both connected. Your intramural fibroids are referring pain. So it's a referred pain. Sciatic pain is the compression of the sciatic nerve, which is the thickest and longest nerve that supplies the back of your leg. So those are 2 separate issues. If you take care of your intramural fibroids, I think your symptoms should go away. Yeah, you might need more diagnosis. Yeah.
Please suggest a mattresses for backache and chair for a desk work.
Yes, so there are many chairs that are available for good desk work. So there are chairs called ergonomic chairs that each of you that are involved in desk work needs to invest in. And the cost range is anywhere between 5,000 to 50,000. And this industry of ergonomics is a very upcoming industry. And even in IT companies and all, when they design the company itself, everything, including their monitors, including their desk height and chair, everything is designed ergonomically. And so personally, if you want to purchase, go for a chair with a good lumbar support mesh. If you're a very tall built person, go for a chair with even a neck rest. Just Google or Amazon ergonomic chairs and you can find a host of those. Look for lumbar support and look for neck support. All right, so that's a generic advice. For beds, if you already have back pain, then you need to really invest in a good bed. Why investing in a chair and a bed are very important is 8 hours of your life, 1/3 of your day you're spending on the chair, so it has to be good. Another 1/3 of your day you're spending on the bed, so it has to be good. So 2/3 of your day are spent either in the chair or in the bed. And so you need to really invest in it so that your spine and body are taken care of. Mattresses, for somebody already with back pain, you need to get a mattress with a firmness scale of 8 out of 10 or 9 out of 10. There are companies like Emma Mattress. Emma Mattress is a German technology mattress company that is very good, that I keep recommending for my patients. And they have a firmness scale of 9 out of 10. There are also other companies like WakeFit and several others. You can probably get those. Ergonomic chair, that's correct, sir. Yes.
Yeah. Then the next question is, good afternoon, brother. I am suffering with disc bulge on L5 for 2 months. 2 months onwards, no rest. On rest, sorry. On rest.
Okay. So is this male, female, age, all of these
Male,
things I
male.
need to know?
Yeah.
Okay. And we need to know whether he is heavy built, lean built, all of that. So what I would say is 2 months of rest. I'm very glad that you were able to get those 2 months of rest. And a disc that is bulged will always come back with rest and come to the same position. But a disc that is prolapsed or leaked out will not come back again. So you need to tell me whether it is just a bulge or a prolapse. And second, if it is only a bulge, you can go into a position called as the Sphinx position. Sphinx, Sphinx. Okay, like the Sphinx in Egypt. You go on your elbows like that. You go on your elbows like that and lie down. Okay, so that your back is curved like that. All right. I can send you pictures of that, maybe to Brother Sudhir, or if you can take my number and contact me later on, I can advise you with that. Yeah.
Okay.
So go on Sphinx position. That will reduce your sciatic pain. Yeah.
Yeah. I have disc bulging issue.
Yeah,
I have disc bulge. Pravanna, you want to say anything?
Yeah. Can we
Please.
use support like this for neck traveling or?
Yes, sir. Yes. Perfect. Yes. Very good. Very good that you brought it up. If you're traveling for too long on a bus or a train or the flight, also please use a travel pillow, neck pillow. If you have a car and you're driving it for too long, you get a back support. If you're sitting for too long on a chair, you can't invest in a new chair, ergonomic chair. It's expensive. Just get the lumbar support and put it on your ordinary chair. All of these are game changers. And if you have neck pain, there is a pillow called as butterfly pillow with wings on the side. So regardless of whether you're a back sleeper or a side sleeper, your head is adequately supported through the night. So there are many things in the market to make our life better, but the awareness is not there, which is a sad thing. I'm glad that you're all asking these things. Yes. Thank you, sir.
Thank you, Anna. I have disc bulging issue, and now from 1 month, I am having fatigue type pain on the right leg, starting from the thigh towards the feet. Is it related to sciatica?
Yes, it is related to sciatica. Sorry to say, and I'm glad that you picked it up. And you really need to go and consult somebody close by, a physio, and they need to be quite knowledgeable also. And they can help you with this. Yeah, they can help you. If you need to get in touch with me, feel free to do so. I'll see if I can help you. Yeah.
What is the exercise for continuous neck pain?
continuous neck pain, there is no one single exercise. We need to first of all find the cause. If the neck pain is very continuous, it is quite a serious symptom. We need to examine it. First of all, you will at least need an X-ray. And definitely you might also need an MRI, in my opinion. So only after looking at it, we will know whether the joint space is reduced or whether the disc is bulged or whether it is only a muscular problem. If it is muscular, it can be sorted out with physio, but you have to go for at least 10 sessions of physio with a good manual therapist. If it is nerve, then we need to see. There is no one exercise for such a severe neck pain, sir or ma'am. I don't know who it is. Yeah.
Yeah, I think we finished. Anybody want to ask question directly? Yeah, somebody said, if I bend forward more than 20 seconds, then I'm unable to come back smoothly. The rest of the time,
Yes.
there is no pain. Age 49 male.
Yes, so we are not supposed to bend forward for 20 seconds unless, don't do it as an exercise. It's very harmful. See, if our bodies are, let's say I'm 70 kilo in weight, if I bend forward, the amount of pressure that goes on my disc becomes 3 times my body weight. So it will become 210 kilos. All right. And again, if I'm 70 kilos, if I'm sitting down on the floor and getting up, my body pressure on the disc will become twice my body weight, which is 140 kilos. So forward bending, especially prolonged forward bending and sitting on the floor and getting up are very bad for disc health. So if you can avoid such activities, please do avoid those. They will only injure. 49 is a a decent age. I'm 49 too. And so you can train your core muscles and avoid forward bending. And definitely 20 minutes of bending forward is like putting 270 kilos of weight on your disc. It will injure itself. Please don't do that.
Thank you. I had open heart surgery almost 2 years past. What kind of
Yes.
exercise to practice?
Walks, please go for walks. And I don't know how much you're walking. Get yourself a nice watch with a calorie and a step counter. These days, there are rings also that have calorie counter and step counters. So ask somebody to gift you that. All right. And wear that and start off with 3,000 steps every day at a very slow, relaxed pace, or 2,500. Slowly build it up to 5,000, then 7,000. And ultimately, if you're able to come up to 10,000 steps a day, which will roughly be 4 kilometers or something, your heart will be functioning really, really, really well. Yeah, but take it very slow over a period of 6 to 8 months. You have to ramp up from 2,000 to maybe 6,000. And depending on your age, you can push it up even higher. Yeah.
Thank you. I have a pain in my lower neck from time to time. What can I do to relieve the pain?
Yeah. So pain in your lower neck from time to time, I'm assuming you must be sitting and working in front of your computer. Do some ergonomic correction. Get yourself a nice chair with a neck rest. And also do what is called as chin tuck. So this is a chin tuck. All of us are sitting like this with a forward-headed posture. So try to pull your head back like that once in a while when you have neck pain. Yeah. So this is called chin tuck. So we need to do that oftentimes. Second is we need to stretch. You need to stretch your neck muscles. There is a group of muscles that come and attach here. So hold one hand on the back of your head, another hand goes behind your back, and you stretch and look at the armpit on the other side. This muscle will stretch out and you'll feel nice, and that will relieve the tension on your neck. Do the same on the other side. This is a rough generic advice, but we really need to know what is wrong with you. If somebody can also apply some amount of moisturizer and massage that little area that is painful for you, somebody at home, that will also help. Apply hot pack. Hot pack, apply it whenever you have pain. That will relax the muscles.
Okay. One of my friends said L4, L5, S1 disc bulged. What shall I do?
You need to come to Vellore. Yeah.
After doing
Yeah,
any work,
you need
I'm
to. Yeah, so L4, L5, sir. L4, L5, S1, 3-level disc bulge, which means it is an extensive involvement. That's why I said it's not going to be easy to advise anything easily. We need to see on an MRI how bad the bulge is, whether it is going and irritating the nerve root, whether there is any muscle weakness, any sensory loss. Depending on that, you will need at least a 3-week program with a good manual therapy or a physiotherapist with orthopedic experience who can teach you how to engage your core muscles and see that even though you have these disc bulges, you don't need to go for surgery if it is not near the nerve. I have 4 disc bulges, all right? And I keep working out my core every day before I treat my patients. So it's possible. Yeah, sorry. Thank you.
How can we book a consultation with you?
How can I leave my number here? I leave my number here. You can probably call and we can do a teleconsultation. Yeah. This is my clinic number and my wife handles this number 90822 that is our clinic number. And we can schedule an online call anytime, Monday to Friday, 7:30 to 12 in the mornings. Yeah.
What I have my lower back one side pain, left one. Any suggestion?
Lower back, left side pain. So it looks more like a muscular pain, sir. If it is not going down the leg, it is muscular. It does not touch the nerve yet. You will benefit from what is called as core stability workout. And you will also benefit from what is called as myofascial release. But these are manual techniques, hands-on techniques that somebody needs to do on you. But for now, you apply a hot pack on your back so that the muscles are relaxed. All right. That's all I'm able to advise, over the Zoom call. I need to know some specific because age matters, the sex matters, how obese you are, how thin you are, and many things matter. So I'm only generically giving you advice. Please don't take this as good medical advice. This is general advice with very little information and very little time. And so something specific, then I think we need to get talking. Yeah.
Yeah. What kind of food suggests to keep spine in good condition?
Yeah. So food suggestions to keep the body in good condition is obviously high protein food. Yeah. Proteins directly contribute to muscle mass. Carbohydrates, when unused and when consumed excessively, convert into fat and they become fat. They don't become muscle. So any diet with a higher proportion of proteins and a very less proportion of carbohydrate with, of course, a lot of veggies and fruits is a great diet. Yeah, not specifically for the back, for the whole body.
Okay. Is there any cure for motion sickness, car sickness?
Yes, there is cure for motion sickness and car sickness. Motion sickness and car sickness usually comes for people that have a high sensitivity of what is called as the VOR. Yeah. Vestibulo-ocular reflex. Okay. There is a vestibular nerve, which is important for balance. It is in the middle ear. And there is the optic nerve, which is responsible for vision. These two nerves are interconnected. Now, when we travel, constantly our orientation to space keeps changing. So the vestibular nerve, if it is weak, will get disturbed. And the ocular nerve, because we are looking at moving things, it also will get tired. And when these two are getting overstimulated, then we feel like vomiting and nauseous and giddy and all of that. So I think your vestibulo-ocular reflex is very sensitized. First of all, I think whenever you are traveling, people, common sense advice, they give us sit in the front seat, look straight at something at a distance, and don't keep looking at all the scenery, especially if you're going to Kotagiri, don't keep looking this side, that side. So just don't use your and tire your ocular nerve. Okay, so look straight. Second is see that your neck and head are supported well in one position, and don't keep turning it too much so that you're contributing to the change in motion, but minimize it as much as possible. Some of you that have severe fear of travel sickness because of past experiences of making a mess and vomiting and all of that, an albumin tablet is helpful, so you can take that and go. Some people prefer to go on an empty stomach, do that. And for some of you that have travel sickness, if you drive yourself, actually that sickness will go away, because our minds are not all the time focusing on what's happening to the body. We are thinking about how we are safely traveling. And so these are little tips. We can do some things from physio also that will help it.
Yeah. Does the perimenopause cause numbness and tingling?
What, sir?
Does perimenopause cause numbness and tickling?
Perimenopause.
Perimenopause.
Yeah. Yes, it can. Not commonly in everybody, but in some people, because there's lots of hormonal changes in the body that are happening. And perimenopausal symptoms are very individual specific and very vague, and not the same across the board for everybody. So it is possible that you can have tingling, maybe not so much of numbness, but yeah, tingling, feeling of hot flushes, and all of that is part of it. But I would advise that you go and clarify that and check that with your OG. Yeah.
Yeah, I'm developing knee pain when I use steps.
Yes. So you must be, I'm sure, sir, or ma'am, a little on the higher side. If it is a lady who is let's say postmenopausal, your calcium might be less, and you also might be a little higher in your weight. So try to supplement with calcium and try to reduce your weight. If you're a man, check your weight and see that you can bring your weight down to the ideal. And there are a few quadriceps exercises and calf exercises that can help make it better. Also wear good footwear and avoid climbing stairs too much. And unless there is a need to, there are many things that can be done.
Yeah. Does reading in bus and train hurt neck and spine?
Yeah, reading in bus and train definitely will overstimulate the VOR, and so it can trigger motion sickness. But if you don't have, if you're using a neck pillow like the brother showed, and you're having a good posture, I think you can enjoy your travel reading or listening to audiobooks if that is a better option. It depends on the individual. Yeah.
Is there a cure for snoring at night?
Is there a cure for snoring at night? See, usually snoring happens when our vocal cords, there are many reasons for snoring. One of the most commonest reasons is when our vocal folds are too much, and the tone in our vocal cords is a little reduced in sleep. Usually it happens to those that are on the heavier side and those that are back sleepers. So side sleeping will reduce snoring a little bit. And if you are on the higher side of weight, you have to try and see if you can shed a few kilos, and that may help. A little bit of propping up of your head end of the bed. Yeah, just keep maybe a little higher pillow or whatever. These days we have triangular pillows, wedge-shaped pillows called GERD pillows or anti-snoring pillows. They will help change the orientation of the vocal cord sag, so the snoring might reduce a little bit. But as long as your spouse doesn't have a problem, don't worry about it too much.
The last
Yeah.
question we will take. After
Yeah.
doing work for a long time, having lower back pain every time, what is the solution for this?
Yeah, I already told, change your workstation, see if it is ergonomic, get yourself a nice ergonomic chair. Every 40 to 60 minutes, please get up and decompress your spine. Do a little bit of stretches, walk around a little bit, and then come and resume work. And also start becoming a little fit and active, and start using your core muscles, engaging your core. And I think those are some good tips.